Hello, good afternoon and good evening and good morning to you from wherever you're watching this. And thank you for making a date with me as I bring to you the big announcement. 13 years ago, when I first took placement in a hospital as a student nurse, I came in contact or face to face with another angle of suffering that we see in our communities. Most of us born in developing countries, I'm from Ghana, as many of you are. Most of you born in developing countries, developing communities and suburbs know how much suffering families and individuals go through, how much work most people put in and still are unable to meet their daily needs, then to talk of health needs and all that. 13 years ago, I met pregnant women who visit the hospital, stay in long queues, and then get to pharmacy for their medication and then don't have enough funds to cater for this. Throughout my career in the hospital, I've seen patients being abandoned in the hospital because families cannot afford to pay their bills. I've seen people rushed in during emergencies by good Samaritans and then they become a burden of the hospital and bills cannot be paid. I've seen people who struggle to just meet these needs, and often myself, colleagues, doctors, and many other workers in the hospital have to either pay for ambulances to move patients from our facilities to secondary or tertiary care facilities. Seen people having to, or we having to commit funds to feed patients, to take care of one medication or the other, because sometimes patients actually break the cycle of medication because they can't afford much. 13 years ago, the problem we have seen has improved. Yes, the health insurance scheme has been doing a lot. The free maternal care, which Ghana is enjoying, has helped a lot. But I can also say for a fact that the problem is still inexistent. A lot of it is still in the existence, because even though the health insurance scheme is doing a lot, it doesn't take care of all the problems. This big announcement should have been something I would have done a year ago. But a year ago today, I woke up to a sad, devastating news of the murder of a good friend of mine, somebody who is a humanitarian and somebody who was in on this idea and was ready to support it. This took me some weeks, months back, and I had to rethink the whole idea, re-strategize, and appraise the whole situation again. And today, I am glad to be bringing this out finally, that today I'm launching the CommonHealth Fund. Now, what is the idea of the CommonHealth Fund? The CommonHealth Fund, for its first phase, I am proposing to begin in my hospital, Richard Novati Catholic Hospital in Sogakope, the Sogakope District Hospital or the South Tongu District Hospital, and also the Akatsi South District Hospital. These three hospitals are proposed to pilot or to be in the first phase of this fund. What we want to do is to be able to augment the work that is being done by hospitals. I shared an article a week ago, written and posted on Ghana Web. This article actually pointed out so many things and threw light on the no-bed syndrome that we have known of in Ghana, a situation which was hampering the quality delivery of healthcare. A contributing factor has actually been this abandoning of patients or people in the hospital and then becoming a burden of the hospital. This and many other initiatives I am planning to roll out soon are supposed to augment or support us and support our communities, that we could be able to at least live a dignified life and get some support. We all know very well how much, or as I've already said, how difficult it is to meet health needs. Health is expensive, and the health insurance situation is okay, but not effective, not 100% effective. So, I mean, countries or other economies that I know of who are thriving get enough support from government, from private sector, and from collaborations like this. Somebody would want to ask why social welfare is not the ones taking care of this. I can say from experience that my interactions or interface with social welfare over the years has proven that social welfare is not adequate or is not enough, or the system in social welfare is not working effectively to meet these needs. Many of the times that we've had people abandoned in the hospital and then bring in social welfare, they let us know they don't have resources and they have to depend on donations or benevolent actions or this kind of things to solve the situation, and it's not the best. What I want to do is have this consolidated fund or purse that can quickly come to the aid of these people, be able to reintegrate these people into the community or their families, so that the beds in the hospitals can be freed up, more critical cases can be attended to quickly. I believe most of you know me in relation to Cliff. Cliff over the years has spent so much in healthcare and our communities to bring smiles on faces, to help people cope better with health conditions, one or the other that they are going through. Since the pandemic began, we haven't been able to go to communities the way we usually do. We haven't been able to, organize screenings on large scales to be able to identify some conditions in the environment or the society and bring timely interventions to them. However, we still have volunteers on the field who are working at the front line in various hospitals and communities. Part of the fund we are raising this month, the month of March, would be used to support 10 families in Kaswa. Now, Kaswa is a town most of you know, just the outskirts of Accra, but it's in the central region. Our volunteers have identified 10 families who are managing children who are suffering from cerebral palsy. Any of you who know about this condition would attest to how difficult it is to cater or to care for these children, psychologically, financially, and all of that. We know how difficult it has been even before the pandemic. Come to talk of within a pandemic, when most of us who are not even faced with this problem are not having it easy. So what we want to do is that by end of March, we would organize something to support these families in Kaswa. That will be the first thing we would do from this fundraiser. Hopefully, after 3 months of contribution, we would then scale out to start taking care of these cases in the hospital. So hopefully by end of June, this fund should take effect. It is each of us wish to see people happy in our environments or our communities, or to see systems work. For a long time, we have been complaining that most of our systems are not working. We have been pushing our governments to do their best, and unfortunately, we are not seeing the results that we expect. But we can't sit around while we see people suffer or people die from things that we can take care of. So humbly, I am requesting that everyone who is listening to this, if you've been following me, if you're my friend, if you're in my circle, if you have been touched by one thing or the other that myself or my colleagues or my organization CLID had done in the past, I'm humbly asking that what do we need, or what do I need right now? I just need the weight of 5, 50, 500 or 5,000 in any currency. That's a monthly subscription. You can make it, the CFA, the Ghana cedi, the pounds, the US dollars, any of those currencies. We are ready to work a system that supports us and supports the common people. We have lost a lot of people recently, at least over the past year, to COVID-19. The pandemic is still with us. We don't want to lose more people. I mean, we can't do much about those who are gone already. Like, energetic people have been lost to this virus. I'm entreating all of us to keep safe, to keep social distancing and staying out of, gatherings and groups. We can still protect ourselves and also take the burden off the health system. Vaccines have been rolled out, and as we all know, Ghana has started vaccination, or Ghana will be starting vaccination soon, I think. We can all still keep social distancing and be free from this virus. We all know how much harm it is causing to us already. We have lost too many. We don't want to lose more people. If you want to be a part of this, if you want to support us, get in touch. One of the things I also want to inform you is I recently launched a personal website, which is telecomugene.org. And on that website, you can find a bio or information about me. You can find information about the charities or the organizations, humanitarian organizations that I am involved in. And one of the beautiful things you can find on the website is also a page that has business information. What I'm asking everybody, if you're a business and you're listening to this, I'm asking you to support us. Get in touch and let's put your information out there on that page for people to see all around the world. We are not asking you to pay us, just pledge or support this initiative that we are rolling out in the communities. We don't need funds for our personal gain. Everything we are doing right now is, or everything we've been doing towards the community, are non-profit. Get in touch. Let's just help you so that at least if it's your marketing budget, you can give us a little bit of it to help people. We can also contribute a little bit to your promotion. I think for now, this is what I would say, and more information as they come by, I would be putting them on the website and on my social media platforms. Telecom Eugene on all social media platforms, Twitter, Instagram, Facebook. And as a last thing to say, we should keep safe and remember those we have lost in this journey, especially my dear friend Malto Ajahi. Shall we observe a minute silence for him and all the souls we have lost? May the souls of all the faithfully departed rest in the bosom of the Lord. Thank you so much for listening to me, and I count on your support.